I take the role very, very seriously, and being the chair of Mental Health Australia has been a great privilege for me. And as you would know, as a peak body, you need to be bipartisan in that approach to do the best advocacy for the whole sector. And I felt I couldn't be bipartisan with some of the issues that were not being addressed at the Labor government level.
The PM argues that his government has put substantial funding into mental health. There was a $500 million package in last year's budget, extra workforce support and extra support for people with severe mental illness. Why is that missing the mark?
It's so far away from what the actual full reform package needs to look like. And I think, you only need to look at the NDIS program, where that's got over $40 billion spent for 680,000 of those people that need care. And mental health is over 5 million people, and yet only $10 billion spent.
Yeah. So how does the NDIS work in terms of mental health? Because some people with mental health can get access to it and some can't. Yeah,
that's right. So there is some in the NDIS that do get mental health support. So that is on top of the mental health budget. But what the sector's been asking for years is a reform package that helps people from early intervention all the way through to complex care. And it seems like it's piecemeal kind of budget announcements, not full reform package that's required.
And you feel like you've been pushing for this year after year after year and just getting nowhere?
Yeah, and I think many chairs and people in the sector have been doing this for a lot longer than me, and they're as frustrated. And more importantly, we also serve the community, and that's why we get out of bed every morning to do that work, is for the people that need the help and care. And they're the ones that are frustrated. They're the people I speak to on the street every day that are saying, what is going on and why is there not more care and support available for us?
Yeah, so take us through exactly what you want to see in terms of that extra support and a much broader approach.
Yeah, so we talk a lot about an all-of-government approach, and as you would know, that has to come from the Prime Minister down. And that's not, Mark Butler's been an amazing health minister, but it's not just his portfolio. We talk about, especially on a day like today, where we are so grateful for the people that serve our country, and we've just gone through a Royal Commission on veteran suicide. It should be in the defence budget, it should be in the education budget, it should be in the housing budget, it should be across all portfolios, not just a mental health related directly. As you know, it's cost of living, everything's impacting crisis and war, impacts everyone's mental health. So it's a lot broader than just being a narrow mental health budget within a health portfolio.
Yeah, so can you take us through some practical examples of what should be there that's not there now?
I think a lot of things around supply and demand of services is really critical. As you would know, and people talk about, it's very hard to access care. It's very hard to get the right care when you need it. The public hospital systems are overbearing with, emergency and complex and suicidal issues. There's not enough beds. We're hearing of private hospitals setting up wards for public patients because of the lack of ability for people to access the care they want. And literally, unless you are so close to taking your own life, you're not accepted into a lot of the systems. So those things are what's driving suicide rates higher. It's what's driving anxiety and depression within family and carers. So there's a huge range of complex requirements, and that's why we've been talking about a whole of government reform package, not just one budget kind of at a time approach.
And you haven't been able to secure any, not one-on-one meeting with the PM?
No.
And how do you feel about that?
Not even a phone call. Well, I just think it actually just shows to me his probably lack of interest in mental health. And, if you look at the transcripts since he's been elected, look at the other things he's talked about thousands of times, he pushed, and rightly so, on The Voice so hard to a referendum, and they deserve that respect. And we voted yes, and we wanted that to go through. But that's 3% of the country, and there's 20-something plus % of the country now with mental health challenges. And for some reason, the PM doesn't seem to be interested.
What did you make of the Health Minister, Mark Butler's statement after news came through that you'd be stepping down, thanking you for your service, but saying that mental health reform, substantial mental health reform, won't happen overnight?
Yeah, and I agree that it won't happen overnight, but it's got to start somewhere. And Mark Butler and I have got a great relationship. I actually spoke to him before I resigned to let him know. I'm very appreciative of his work that he does. I actually think he cares a lot. I think it's just very hard for him to get an all-government approach when the Prime Minister doesn't want to have the conversation.
Do you actually hope this move by you will bring a spotlight and possibly more action in this field?
It's not the reason I did it, but if anything can help move the dial and the needle for the people who, you know, like myself, who's got lived experience, can access better care and a better system for our kids and nephews and nieces, then, you know, if that's what has to happen for me to step down to do that, then that's part of my job. I've always said I'd only take and do the role when I thought I could be effective, and unfortunately in the recent days I learnt that was the end of that road.
Yeah, you're obviously really passionate about this. You're only several months into your second term. How tough has this decision been for you?
Yeah, very, because it's the passion. Like you said, it's not just a passion. I'm very lucky, and I've been very open about my own suicide attempt, and I'm very lucky that I've got a second chance at life, and I saw this as a way to serve my country. And to have to stand away from that was very difficult, but I felt it was the right thing to do, and it was a responsible thing to do as the chair of Mental Health Australia, because the organisation will carry on for decades past me, and I didn't want to bring that office into disrepute by not having a bipartisan position, because I couldn't also sit there in silence against my own values of what I think is fair and what this country needs.